Hey everybody, it's Dr. Chad here again from Livewell Chiropractic. We're going to do another video. We had such a good response to the carpal tunnel demonstration video that we did regarding ART that we're going to do another one. This time a little more common problem. We're talking about upper back pain. So this is something that we see every day in our office. It's a big problem. People get a lot of tension, muscle tightness. People that do a lot of sitting at work, at the computer, tend to get some rounded shoulders, and you put some stress on the upper back, on the muscles. And we're going to talk a little bit today how we can deal with that or fix that with active release technique, or ART. Now, being a chiropractor, we're always going to address any of the chiropractic issues. We're going to look at posture, if there's any imbalance in the spine here, and address the muscles. But specifically with ART, what we're going to go after are these muscle knots that just about everyone has. So most people, we can kind of poke around right around the shoulder blades and we'll find some tender spots. And those are those muscle knots that can be very hard to get rid of and very hard to treat. So with ART, we can be very specific in trying to release that. So one of the issues is that this is an area where we have different muscles that kind of overlap and they get stuck together. So the one muscle, we call it the levator scapula, it comes from the corner of the shoulder blade, goes up through the neck, and this is the one that a lot of people think of. They move their shoulder around, it's tender, it's painful, and we also have what we call the supraspinatus, which comes across the top of the shoulder blade, and then we have the trap muscle, the big trap muscle that kind of lays over top of all that. So what we want to do with ART is isolate those specific muscle movements and try to release that to get the muscle moving better, get the muscles moving independent of each other, and that's when we really get that muscle knot to just melt away. So we do that through a series of protocols and movements to try to get that muscle to release. So I'm just going to have you bring your arm down behind your back, hold that there, take your head, look down towards your left knee, and as we do that, we can just literally feel that muscle release and that tension go away. Now, sometimes we don't get this to release fully after one treatment, but through a series of treatments, we usually can get some very good results getting those muscles to literally, that muscle tension to literally melt away. So if you're having some trouble with these, with some shoulder pain, with those muscle knots here, and you've tried either massage or chiropractic, and you might think ART might be a good treatment for you, give us a call. We can evaluate you and see what's going on and see if we can do something to help you out. Thanks.